AAPC Coder Search provides quick access for looking up CPT, HCPCS Level II, ICD-10-CM, and ICD-9-CM medical codes. Enter a code, keyword, or phrase, and AAPC Coder's powerful database instantly provides detailed code information. The Electronic Alphabetic Index search lets coders look up terms in the same way they do in their books. Code results are provided in lay terms, explaining codes and rules in terms you understand. Coder Design Search Logic lists the most relevant results on the top. AAPC Coder has the option to search by keyword, code, or code range. Enter the keyword in the search bar and click Search. This populates the options for the keyword from code set indexes, KECM, and tables. You can narrow the search by selecting one of these options in the drop-down menu. You can sort by KECM or number. Expand the result by clicking the plus sign. Once you have identified the code, click on it. When selecting a diagnosis code, under Coding you have access to the long descriptor, block notes, chapter-specific coding guidelines, and AHA Coding Clinic. Click the arrow next to each option to view the information. The official long descriptor lists the description, use additional, includes, and excludes information. Block notes contain the information for the family of diagnosis codes. AHA Coding Clinic provides expert advice. ICD Coding Clinic is the ICD code set's official authoritative reference published quarterly by the American Hospital Association, AHA, Central Office. Cross-references are multi-directional and include ICD-9-CM, ICD-10-CM, ICD-10-CM CPT, ICD-10-CM DRG, PQRS, and HCC, depending on the package purchased. Click on the arrow next to each option to view the cross-reference information. PQRS cross-reference identifies if the diagnosis code is part of a PQRS measure, provides the description of the measure, the reporting option, and additional information. HCC cross-reference identifies if the diagnosis code maps to an HCC code. You can view additional information by clicking on the HCC or RxHCC code. The Notes section allows you to add your personal note and save it to the code within your subscription. You are the only one that has access to these notes. Under the CMS Center, you have access to transmittals, the claims processing manuals, and the CMS MLN specialty book. Let's use keywords to search for a CPT code. You can use a phrase such as knee arthroscopy with meniscectomy and click Search. Click on the plus sign to expand the options 29800 through 29999. You see options for 29880 and 29881. You can click on those to view code detail information. When selecting a CPT code, you will have access to coding information, claims edits, cross-references, fees, the Notes section, CMS Center, and illustration. Within the coding section, click on the arrow next to the information you would like to view. Options are code descriptor, lay terms, BETOS, CPT guidelines, upcoming and historical information, CPT assistant, and articles. CPT assistant is the official word from the AMA on proper CPT code usage. Selecting CPT assistant provides you links from the CPT assistant archive that are related to the specific code you searched. Articles provides links to coding alert articles related to the specific code you searched. Within the Claims Edit section are tools to help you determine if the code or codes you are using will hit an edit and if it is appropriate to unbundle that edit with a modifier. CCI Edit Alert lists the Column 2 codes or component codes. Use the modifier indicator to determine if the Column 2 code could be unbundled or billed with a modifier. There are two options under Allowed Modifiers. One for modifiers applicable to the CPT code if used by a physician or professional. The second is a modifier crosswalk listing the modifiers applicable to the CPT code for ASC, ASC and physician or physician professional. The LCD lookup is used to quickly determine if the diagnosis for the procedure is considered medically necessary per location. Enter your state or zip code and contractor type, or select All to see if any states have an LCD for the CPT. Click the LCD button. If there are LCDs, they will pull up with the jurisdiction, contract type, contractor name and number, LCD ID, and title. Click on the link to view the specific LCD information. Medically unlikely edits information is also available to help limit fraud and/or coding errors. A MUE is a unit of service edit for HCPCS or CPT codes. The ideal MUE is the maximum UOS that would be reported for a HCPCS or CPT code on the vast majority of appropriately reported claims. Cross-references include CPT to ICD-10-CM, CPT ICD-10-PCS, CPT ICD-9-CM, CPT to ICD-9 Volume 3, CPT Revenue Code, and PQRS. The Notes section allows you to add your personal note and save it to the code within your subscription. You are the only one that has access to these notes. Within the Fee section, under Fee Schedules and RVUs, you have the option to look up the fee by carrier or locality with the Fee Schedule calculator. You also have access to Medicare fees and RVUs for facility and non-facility, global period information, modifier guidelines, and medically unlikely edits. This section also provides an anesthesia crosswalk and OPPS information. Under OPPS, you can quickly view the OPPS fee schedules for freestanding ACSs and hospital-based outpatient services. For each CPT code, you can identify the applicable modifiers, status indicators, and payment indicators. For procedures that require devices, you can view if there is a credit adjustment policy for the device. Illustration provides a picture and description of the procedure the code represents. Enter a code in the search bar and click Search. This takes you directly to the code information. Enter a code range in the search bar and click Search. This populates the options for the keyword from code set indexes, KECM, and tables. Follow the same process as search by keyword. This demo included tools that are available with the Coder Complete package. CPT Assistant and AHA Coding Clinic are add-on features.